radioactive iodine seems like a really bad thing. What is your opinion of that?
That's going to be one of the recommendations for people with Graves' disease. And one of the things that it can do actually can exacerbate the Graves' eye disease that we talked about, where the eyes begin to protrude. It's something that destroys the thyroid gland. And so I would say if you have a chance, when you destroy the thyroid gland, then you're basically going to have to take thyroid medications for the rest of your life.
Or take
What
it out?
Right, or take it
Yeah,
up. If you take out the thyroid gland, that also
you have to
happens as
take out.
well.
Yeah, take the medications for life.
Yeah, and there's other options too. So before the radioactive iodine, consider doing medications and definitely working with a functional medicine doctor to try to address the root causes. There's also immune modulating. There's one immune modulating medication, low dose naltrexone, that also may be helpful for modulating the immune system and can get some people with Graves into remission. So there's so many different options for you out there that, not to say that nobody should ever get their thyroid gland removed, but, like look at all of these different options you have in front of you. And there's so many different things you can do to get yourself better and into remission and healed without having to take an organ out. One of the big things that can be triggering both Graves and Hashimoto's is an infection known as H. pylori.
Yeah,
So some people will find out they have this infection, they'll get treatment for it, and their autoimmunity goes into remission. And sometimes it's as easy as that, where you just remove a food or you remove an infection, and you can get better without having to live without an organ or having your thyroid gland damaged by radioactive iodine, because that's what it is. It's basically renders your thyroid gland not functioning.
they're like, we're gonna your thyroid gland is not working right, so we're just gonna try to kill it, right, and poison it, and maybe it will not be as bad or something, right?
Right, right. And
Not
it
work as
just
it's working badly. Maybe it'll work less badly if we poison it.
Yeah, and it just, I think when, in 100 or 200 years from now, we'll look back at things like that when medicine's more advanced and we'll say like, wow, we were really doing these things to people. Like, when you think about people getting lobotomies
Yeah.
back in the day, like I think we'll be looking at things like that the same way.